Hi, my name is Dr. Joe Kras from Washington University in St. Louis. And this month I'm interviewing Dr. Kellin Reynolds from Louisiana State University, who was one of the authors of Use of the QR Reader to Provide Real-Time Evaluation of Resident Skills Following Surgical Procedures. I don't know about you, but I know in our program we find it somewhat challenging getting consistent feedback from faculty and our residents. We've gone from paper forms to an online system which even sends email reminders out to the faculty, but still we have problems getting those forms returned to us. So I was really excited to see this article out of LSU. Kellin, how did you come up with this idea of using smartphones to get your feedback?
2 years ago, one of the faculty members at LSU, Dr. Barnhill, came to another resident and me with an idea that we would do a new portable electronic evaluation system. We'd already been using the QR codes to evaluate our lecture series and grand rounds. Dr. Barnhill had an idea that we could possibly use this evaluation for residents after surgical procedures. We had been using a paper evaluation system that essentially was outdated and underutilized. I had more completed paper evaluations sitting on the floor of my car than I had in my resident file. So, the three of us got together and developed this method using SurveyMonkey and the Microsoft Tag platforms.
What do you foresee as the implications of this process for program directors? Do you think it will make their life easier or more complicated?
I think in the end it will make their life much easier. When Dr. Barnhill originally presented the idea to Jamie Sias, the other resident, and myself, within 1 month we had designed the entire process from scratch, created and printed all of the IDs, and presented the concept to all residents and faculty. And it was ready to be used within 1 month. There's a lot of work on the front end for the initial setup, but once it's up and running, the system essentially runs itself. Our program director, Dr. Polite, really likes it because SurveyMonkey generates reports and all of the residents get their evaluations each month.
Since younger people are much more plugged in nowadays, I'm going to assume that the residents were comfortable with doing their reviews in this fashion. What other benefits do you foresee for trainees, given your results?
That's correct. The residents were very comfortable with the system. The majority of faculty were also very comfortable evaluating residents this way. The ones that weren't comfortable learned a little with all of us. It was very well received by our program. Right now, actually, the latest thing that we have done is redesign the surveys to look at our resident milestones. We will use it as an evaluation system to look at all of the required JGME resident milestones throughout their resident training. I think this will be something that will be big for our residency program and other programs.
Do you and your co-authors have any plans for sharing this process with other programs?
We have shared it with all of the other program directors in the LSU system who are also working on developing this as an LSU-wide evaluation system. Dr. Barnhill and I were also presenters at the JGME conference this year and presented at one of the sessions to a few other program directors. It was also well received there. And we have developed a website that is available for anyone who wants to set this up for their own program. It goes through a step-by-step process for developing their very own evaluation system.
Would you mind demonstrating for us how your system works?
Definitely. So I have my smartphone right here, my tag right here. An attending just needs to scan my tag, fill out the evaluation, press submit, and it's done.
Well, thank you for taking the time to go over your article with me, Dr. Reynolds. I look forward to seeing more innovative ideas from you and your collaborators in the future.